afternoon, everyone. Today with me is Ms. Chanel Beard, the president of the Wellness Center, as a part of the Young Influencers Suicide Prevention Awareness Campaign. My name is Aaron Cinto, the interviewer. Now, I will now invite Ms. Beard to introduce herself.
Hi, good afternoon, everyone. So, as Aaron would have said, I am Chanel Barrett. I am the president of the Wellness Center, an organization that deals primarily with mental health and well-being. We have been in existence since 2019. We have done quite a lot of impactful work, but over the past year or so, we've been on a bit of a backtrack, just trying to get things more streamlined so that we can provide better and bigger services within the next year. Thank you.
Thank you, Ms. Beard. Straight into the questions. Question one. What specific therapeutic approaches are most commonly used in Guyana and how are they adapted to local needs?
Alright, so primarily in Guyana, we tend to focus more on a psychotherapy approach. So that's a lot of talking, a lot of listening, and more like a conversational approach when it is that you meet a client for the first time. Over the past few years, we have tried to adapt the newer approach to that, which is called cognitive behavioral therapy, commonly known as CBT. What that does is that it mostly focuses on your thought patterns and your beliefs. So it kind of guides that process by allowing the person to express not what the problem is, because with CBT we tend to not focus on what the past issue was, but how exactly we can tend to tackle that issue so that going forward you're able to have a better action plan as to how exactly you're going to manage this particular mental health condition that you have.
What are the most common methods used to ensure that these therapy services reach those in remote or undeserved areas?
Okay, so definitely within the past few years, I know that the Ministry of Health and Mental Health Unit, primarily in collaboration with the GPHC, they would have done an excellent job in ensuring that they utilize the health centers, which I know that we have them across all 10 administrative regions within Guyana. And I know for a fact that they would have initiated both adult as well as child and adolescent psychiatric clinics within all regions with the exception of Region 8. And that is intersected within regions 3, 4, and 5 for both the adult as well as the child and adolescent psychiatric clinics. So those are definitely one of the methods that we see them using primarily. Additionally, we have to still depend on the phone lines. So the suicide helpline has been instrumental in that. It's available 24 hours for those persons that do not know that. And once it is that you're in an area that has cellular service, or as you know, some persons would use the solar phones as well in the hinterland regions. So once it is that they have that access, they can definitely contact the health center, the suicide helpline at any hour of the day, and they'll be able to get assistance. And last but not least, ever since the COVID-19 pandemic, we've understood the power of social media. So once it is you have access to internet, definitely making use of that has become a powerful tool to reach persons across the globe and across the region as well. So yeah.
What funding or sponsorship opportunities are available for individuals who cannot afford therapy services?
Alright, so this is definitely one of the issues and one of the reasons why I started the Wellness Center, because we realized that there was a need for the services and most of the persons in Guyana are not able to afford it. And of course, we know that the psychologists that do provide these services, this is their job, so they will charge you. So one of the things that I proud myself on with creating the Wellness Center is that every single activity that we've had, whether that be counseling, therapy, alternative therapy sessions, workshops, they were all free. So that would definitely be one of the ways in which you can make sure that opportunities are available through the use of NGOs and other organizations that are key stakeholders that play a role in terms of ensuring that we maintain a positive health and well-being of our population. As it relates to additional funding, I know that the Georgetown Public Hospital, through their psychiatric department, they do offer both adult as well as child psychiatry as well as psychological counseling and testing, so those services are available for free. However, I think we have a long way to go. I know that we would have passed the mental health protection and promotion bill in 2022, and we would have recently launched the mental health action plan. So I'm very keen on seeing what it is of the funding opportunities and these sponsorship opportunities will be like, because we definitely know that is one of the factors that cause people to not reach out for help, because not everybody can afford it. So we need to do as much as we possibly can to ensure that these services are not only accessible, but affordable for all.
And the next factor would be cultural sensitivity. So, how important is cultural sensitivity in therapy practice in Guyana? And how do we ensure that therapy options are culturally appropriate?
Well, I definitely believe that cultural sensitivity is of utmost importance within our country. We have a melting pot of different cultures, different religions, and beliefs. We must take those persons' beliefs, their ideas, and their values into consideration when it is that we're thinking about mental health care and our approaches to therapy as well. I think as professionals, one of the things that we need to do constantly is ensure that we educate ourselves on the different cultural norms within the different, whether it be religious norms, and of course there are persons who don't believe in anything, so we have to take that into consideration as well. And we need to tailor our approach. When it is that you're doing a therapeutic approach, I don't believe in the same school, classroom-like approach whereby it's a one-size-fits-all. Somebody could walk in with depression, yes, but there are different levels of depression. They could be functional depressions. They're going to work every day, they're smiling every day, they're laughing, and you don't know what's going on internally. So you can't just say, okay, here, this person who's clinically depressed and this person who may just have seasonal depression, you can't just say, okay, here, this is an activity and we want you to follow it. No, we need to ensure that we understand what is this person's background, what do they believe in, how exactly can we tailor our approach to suit them. Because at the end of the day, we want to be respectful of person's culture and their religious beliefs. We want to make sure that we're taking their values into consideration when we're creating an approach towards them. So I think that's one of the things we need to definitely focus more on, and just ensuring that we seek feedback from the clients as well. That was one of the most important things for us to do at the Wellness Center when we had our support groups, is sit down and find out what is the environment like at home. If it is that I say to you, practice mindfulness, how would your family view it? How would your pastor view it, or your pandit view it, whomever it is? How exactly would they take this particular approach? Whenever you're going to whatever institution you believe in, how exactly will your religious leader or your community leader or your mother, your father, how exactly will they take it? How will your partner take it as well? So we have to take all of these things into consideration, because culture is not just boxing, yeah? So why that was, it's so much more to it. And we need to make sure that we seek the feedback so that we find out, are we being respectful of your culture? What if it's when I give you an activity, when you go home, you have to hide and do it, or can you do it in the open? Right? Because we don't want to have persons coming and they're getting help, and then when they go home, they're going back to the same environment. You need to make sure that you tailor your services so that when they go back to the environment, you're still able to practice in whatever possible way. Okay.
And how do current policies impact access to therapy? What changes would you advocate for to improve the current situation in Guyana?
Alright, so regarding the current policies, I think that few of the most important things that we need to tackle would definitely be availability, of coming back to affordability, and the quality of the mental health services that we are providing. I haven't had the privilege of reading the mental health action planners yet, but I know that they're taking a very humanistic approach and they're doing it on a community level, which I definitely applaud. But I hope that they break it down further to that individual level as well. But regarding the policies, I want to see a greater approach to ensuring that we have the right infrastructure. So there needs to be a lot more funding. I believe it was back in 2022 for World Mental Health Day. We would have taken a serious action, this is globally. We would have taken action against making sure that mental health services become accessible and affordable for all. That was the campaign that they were pushing. And I think that locally we definitely need to do that. We might have the adult and the child psychiatry services available at these health centers, but what is the quality of it? Who's actually providing these services? When you walk into the facilities, what is the condition of the facilities? Sometimes you go into a building locally and you wonder really how exactly are people existing in this. You're coming for therapy and you're walking in and there's no washroom or there's no any proper facility. That can't work. So we need to make sure that we provide adequate funding for these centers, adequate funding when it comes to providing therapy. Make sure that you have a welcoming environment. You don't want persons to leave there more depressed or more anxious than they came in. And coming back to availability, making use of the internet, make use of it. We would have seen an amazing response when we launched our mental health toolkit back in 2020. We launched mental health toolkit, we had an online counseling clinic. It was phenomenal, the response that we got, because persons sometimes they want to remain anonymous. They don't want to come into you know what, like how we're sitting face to face, maybe you might not be comfortable with it, but online, no, you don't need to know me, I don't need to know you, per se. But definitely I'm providing that support, and that's the most important thing, making sure that persons feel comfortable with it. So the policies need to take all of that into consideration. And as it relates to what I advocate for, definitely having a more holistic approach to mental health care and having a more integrated approach to general health. We oftentimes view mental health as separate from physical health. We can't have such a singular view of it. We need to have more of a binocular view. We need to see it through the same lens, because you can't separate the mind from the body. You can't separate the brain from the body. Oftentimes, where persons are declared brain dead, right? And we declare it a miracle if it is that they, are able to reintegrate into society. They're able to come back to life, as we say. All right. So why exactly are we separating mental health from physical health? One of the other things that I'll advocate for, that I hope that the young influencers will push, is what exactly is the policy regarding that for insurance? Because that's another way we can tackle funding. Yeah, your insurance card, you collect a medical insurance card. What is the coverage for if it is that I need to see a therapist? What is the coverage if it is that I have an issue that I need to have medication for, as it relates to a serious mental health issue, because if you're having psychosis or anything to that extent, or even depression, some persons are medicated for that. Are those things covered in your insurance? Are they covered by NIS? Because we're paying NIS. At the end of your time in paying NIS, we have our senior citizens, many of them get dementia. That's a mental health issue that we don't often talk about in Guyana. But it is an issue that many of our senior citizens actually face. So is NIS taking this into consideration? So all of these things are definitely important, and I would love to advocate for them, and I hope that the policies that we're putting into practice, that they take these into consideration.
That brings me to the end of the general questions. Now I have some questions specifically about the Wellness Center. Can you describe the core mission and services offered by the Wellness Center?
Absolutely. So the main aim of the Wellness Center is to provide support and, of course, to break the stigma against mental health illness, to raise awareness, because we need to make sure that persons are aware of what they can do to offer support for themselves, for their loved ones, and anybody else that's involved. We need to make sure that the schools know how to deal with a child that's suffering from mental health illnesses or issues. We need to make sure that your workplaces are also aware of these things, because we want to make sure that people are maintaining that work-life balance. And I think that we would have asked about the services that we would have offered. I'm saying would have because we're currently on a break. But definitely we are working to have that funding so that we can start back at these activities. But previously we would have offered counseling, we would have had the first organization and the only organization in Guyana to offer depression support groups, as well as alternative therapy sessions. So when you bring that into the plate, a lot of people appreciate that. When I say alternative therapy, I'm referring to things like yoga, meditation, mindfulness, art therapy, music therapy, and the list can go on. But those are some of the things that we were primarily focused on offering.
That's a long list. What therapeutic methods or interventions does the Wellness Center use to support individuals at risk of suicide?
Well, definitely, I would have given a hint to that before. Personally, I wanted to take a more integrated approach, a more holistic and integrated approach. I didn't want to just separate it as an, okay, this is mental health care and this is suicide prevention, because it goes hand in hand. So having a more holistic approach whereby you combine talk therapy, counseling, all of these things with the alternative therapies. I think that that's one of the most powerful ways that we can reach the population, especially the young people who we see experiencing high incidences of self-harm and of suicidal ideation. We want to make sure that these persons are educated on how to deal with these, how to handle them, and more so have a bit of an escape from it. And that's where the alternative therapies come into being. So you take somebody in the gardens and you have a little painting session and you give them the right kind of environment, comes back to environment again, it can definitely help to improve their moods. So I think that that's one of the most powerful approaches that we would have taken, and I hope that we continue to take that in the future.
A little off topic, and I hope it doesn't catch you off, but what advice do you have for people that don't see talking therapy, counseling as effective?
I respect that decision. Because at first I did not. I did not believe in talk therapy because I'm the kind of person that I don't, contrary to what you're saying today, I don't speak much. And I definitely never wanted to talk about what was bothering me. And the first time that I spoke about my mental health, it was on a stage in Paris, whereby I ended up winning that competition, and that's how I started the Wellness Center. So talking is a powerful thing, but you might not feel comfortable with it. So I respect that decision, and that is the reason for implementing a holistic approach. Because you may not like talking, but you may like art. You may love music. You may like doing yoga. You might just like being fit. So all of these things we need to take into consideration. So I respect their decision and make sure that we have a tailored approach to suit that person.
How does the center educate the public about recognizing and responding to the signs of mental distress or suicidal thoughts?
But definitely do so by pushing awareness. So we would have done several campaigns. We would have had campaigns whereby we went into the schools, we talked to the students. I talk about that interaction quite a lot because I learned a lot from the students that day. It's amazing to see the kind of idea that young people have towards mental health, and it's amazing to see the fact that they actually want to take care of their mental health from a young age. It's just that sometimes the older folks, they don't understand that. They don't understand. They think, oh, you're just a young person, you know. You know, that's how society is. We know about mental health, we know about depression, but the truth is that the young people actually, they face these things sometimes even more than the adults do, because their ability to cope is oftentimes not as developed as somebody who's older. And we need to understand and appreciate that, and we need to ensure that we're protecting these young minds, and that's why we would have taken the stance of ensuring that we're going to schools to find out what do you view mental health as, and how exactly do you practice self-care. Teach them about self-care, teach them about taking care of their mental health. And in addition to that, of course, we tackled the churches, we went into different religious groups actually, and I learned quite a lot about how different religions and different cultures view mental health. And it was definitely a teaching experience for all of us that were there. Apart from that, we of course have general sessions whereby we invite the general public to come, because we want to make sure that your families, your loved ones, your partners, they know how to deal with you. Many times we see domestic disputes happening with persons who, okay, so there's one partner with a mental health problem and the other doesn't have one, and they oftentimes don't know how to interact with each other. You know, the person who has the issue, they can't explain it in detail, and then the person who doesn't have the issue, they can't see it from that viewpoint. So you want to teach them how exactly do you coexist with somebody who has a mental health problem. But definitely conducting these training sessions would have been our asset in maintaining our campaigns, our mental health toolkit, having online sessions whereby we educate the public. This is how you deal with depression, this is how you deal with anxiety, these are the methods for ADHD. So yeah, that was definitely the way that we went.
And through these campaigns, surely you've had some success stories. Can you share any success story or positive outcome that have resulted from the Wellness Center's suicide prevention program?
Absolutely. Well, as I mentioned earlier, it's not just tailored to suicide or program, but it's tailored to mental health in general to ensure that we tackle it from a holistic approach so that we reduce the incidence of suicide as a result. However, one of the success stories that I think that I'm at liberty to share would be from one of our own members. So while the person did not have any issues in terms of suicide or suicidal ideation, they did struggle because of their weight and among other factors. And we had one of the best workshops that we ever had, whereby we taught to incorporate a little bit of therapy. So we had somebody, a psychologist, that was there to speak to the participants on taking care of your mental health. We had a food and nutrition expert who was talking about how exactly do you eat healthy so that you make sure that you take care of your mind and body. And then we had somebody that was there as a fitness instructor, and we had an excellent session with the participants. And from that, one of our members said, you know what, I want to make a life change. And I'm happy to report that we actually did a session on this, it's on our Facebook page, whereby he lost over 50 pounds just from attending that session, ensuring that, okay, I get my mind right, I get my body right, and everything. And he was just so much more happy and full of energy after. Not that he wasn't before, right? But it just made such an impact on his life. And he spoke highly about that, because it's important that we don't just take, again, this one track minded approach, but we take a holistic approach to mental health. And I think that that was one of the success stories that, again, I'm at liberty to speak of. There are many more, but those will remain confidential, so yes.
You mentioned that the Wellness Center is currently dormant, but you are working to be back. Can you inform the public on any upcoming projects or new initiatives that you're excited for?
Yeah, absolutely. Providing that we get the support that is required when it is that we get back in action, you're going to see pretty much a lot of the services that we would have had, but there's something even more exciting that we have planning. And I think it's going to appeal more to the younger generation because it's going to be a lot more online based. So it maintains that confidentiality. You can remain anonymous, but at the end of the day, it's going to keep you interactive. It's going to keep you updated on the different techniques that you can use. I'm not going to give too much away because we haven't launched this yet, but it's definitely going to be great once it is week.
Thank you again, Ms. Beard, for being a part of our interview series. And thank you for being an advocate for mental health and suicide prevention in a holistic approach. Thank you all.
Thank you for having me.